Hi guys, welcome back to my channel. If you're new here, you're welcome. If you're a returning subscriber, you are also welcome. You guys have been doing so much for me and I want to appreciate you guys. I mean, you guys don't even want to know when I'm actually doing this video. We'll do anything to put smile on the faces of my viewers and my subscribers. Like life of a vlogger, of a YouTuber with a toddler. You don't want to imagine, you don't want to have an idea how it looks or how it feels. Like, I actually went for a birthday party today and as I just got back in, I'm like, oh, this is a very good opportunity for me to shoot this video, like for me to make this video because of makeup and all that. So but then I had to wait till this time so that my toddler can sleep. You guys need to give me thumbs up, give thumbs up for this video and make sure you share it because it is not easy. Support your girl. But according to the topic, you already know that I'm going to be talking about the step-by-step guide. Like, I've got so many messages, so many questions, so many, inquiries after my last video, and I just said I need to do another video to make this thing very clear, like to make it clearer, because it will really help me and to also help everyone out there. I can't really be typing and responding to everyone coming at different time. So by the time I do this video and put it out there, it will actually help a lot of people. Help those people that have been asking and help those people that have some questions inside of them and have not been able to reach me or are not able to reach me. So guys, if you feel that you're interested in this video, just stay tuned and make sure you watch to the end of the video. Okay, let's start like this. So there's something called the health and care visa. It's also the same thing as skilled worker visa. Health and care visa is also the same thing as skilled worker visa. So this same visa, because this was the same visa I came in through while I was coming from Nigeria, made me to know so much about this visa, this particular visa. So this particular visa has been what so many nurses have been using to come into the UK. It's also called Tier 2 visa. And Tier 2 visa means that you've gotten a job and it's a visa that is covering you to come and work and to come and use your skill. You are a skilled personnel, so you want to come and use your skill. You've been offered a job in the UK and that's the visa that is bringing you in to come and work by your employer. If you understand, I'm just trying to say it in a very simple term that everybody will understand. So it means that there's an opportunity that has been opened for you that you need to come and occupy. That's why you're coming. And before now, this is what all nurses have been coming in with when it was added to the shortage occupation list in the UK. You can read up about it in the gov.uk website. Everything is there. So what is happening right now is that healthcare assistants that are not nurses, I hope you get. For nurses, you have to go to a particular school and get trained. But for healthcare assistants, you don't have to be trained like a nurse in a particular school or be registered with a particular body. But it's just for you to have a certificate that, oh, you've undergone something like care and you know something about caring for people, which anybody can do. So this same kind of job, which is healthcare assistant kind of job, has now been added to the shortage occupation list in the UK. Just the same way, like the way nurses, nursing as a job was added to that list. So this is a recent development. It's happened late December 2021. So now we're in 2022, and the plan is just for 1 year, and that's why you need to hurry. Don't let's even go into that. Let me just break it out. So because it was added to that group or to that list, it means that healthcare assistants from outside the EU, I mean outside the United Kingdom, from any other country, say African countries, for instance Nigeria, can actually apply and get um, an offer, a job offer, and then we'll be able to come in using the job offer now to get that visa, and will be able to come in as a healthcare assistant basis. I'm sure we understand that one. So what happens is that there's some basic things that one needs to get, just like, okay, as a nurse, I've done videos being a nurse, what I did, those steps and those levels. But for healthcare assistant now, you need to have an experience in the healthcare setting. You understand? We know that while I was in Nigeria, there are people that healthcare assistant that they just, most of them have a basis or let me say basic certificate, like senior secondary school certificates, which can be NECO, which can be WAEC, and they just go through some time for training and all that, and they get some certificates just to boost their CV, just to boost their just to sell their markets, something like that, to boost their CV and to be able to get healthcare assistant. If you ask anybody in your country, most especially in Nigeria, that are healthcare assistants, sometimes they call them oddly. I think we call them oddly in Nigeria. We call them maybe nursing assistants or health assistants. Yeah, I think that's what we call them more in Nigeria. We ask them their qualification or their basis, you will know that it's more like O level or whatever, A level certificates, and maybe they just did 1 or 2 courses. There are so many online courses now. There are so many online courses that where you can even get these certificates, and there are free online courses. You can even get basic life support online, like do the course and get the certificate. At this point in time, you can do, if you don't have the time to actually go to a physical, but you can do those courses. But I think the experience also matters. So that's why you need to find a particular place. There are care homes in Nigeria, there are elderly homes in Nigeria. So one can go to places like this, because most of this care will be like for the elderly and for people that are maybe the people with disabilities, people that are vulnerable, that you have to do total care for them. When I mean total, I mean total care for them. That's what it entails, and that's why they are bringing people in. So most of these jobs will be found more in the care homes, like care home settings. You can actually find them in the private hospitals or NHS. That's a big hospitals or government hospitals here in the UK, but it's more available. Like you have better opportunity or better chance of being offered a job with the nursing home, because they have so much so many residents and all that. So that is just one of it. And then IELTS is like English exam that one normally write before coming into the UK. Especially UK don't really joke with English exam. Like they want to test your level of English. They want to know if you can communicate better in English. They want to test it in listening, speaking. They want to test it in writing, and what's the other one other modules like that. They will test all these modules, and then the band for this job is 4, between 4 to 5. You can make 4, you can make 4.5, you can make 5. It's fine. And to make those band or those scores, it's very easy. It's not like something that will be really difficult. It's really not bad, because one already have the background already. And as schools in Nigeria, most of the schools were taught in English, so there's no how one will go for that IELTS. I am not saying you shouldn't prepare. You can just prepare, but it doesn't take so long for one to prepare. For those people that have been writing IELTS before, they will understand this, that band is really something that can be easily, and that they can easily get. And it's UKVI. Once you're applying for, what's it called, once you're applying for IELTS, those options will pop up. You'll see the UKVI, UK General, UK Academic. So you choose UKVI and you apply for that one. Then there's so many centers in many states, wherever state in Nigeria, there's so many states that offer, where this exam is being written, and almost every weekend in some states like Lagos State, that you can easily get a date and write the exam. So these are the two basic things that you need. Sometimes even some employer won't even ask you for IELTS. Yes, some employer won't even ask you for IELTS. But just for you to be at an edge, as like a better opportunity, there's so many people who apply for this job, and it's highly competitive because it's a new one, and a lot of people have been waiting for this kind of opportunity. So you want to make sure that there's nothing that you are deprived of. Like there's nothing that is making you look like somebody is having an edge over you. So it's better to just do this exam, whether you're using it or not. Just have it, and just keep applying. Okay. So another thing that you're supposed to have normally, you're supposed to have a valid international passport. If you don't have that, you need to go get it. You can't even we can't even be talking about this if you don't have a valid international passport. If you don't have anyone, I think it's about, maybe, I'm not so sure how much it will be now, maybe like 30 to 35,000 naira. You need to have that. And we've talked about IELTS now. I think it's around between, let's just say 79 or 80, let's just say around it, like 80,000 naira. Okay. And then the experience, you need to gain the experience. The experience should be like about 300 hours. So anytime you're free, if you're working, you can just pop in, do one or two, just for you to have a basic knowledge. You're not working as a nurse, you're not giving injection, you're not doing something so invasive. That's not what you're doing. Just do. I remember I said this in my last video. I remember the last COVID, security guards outside maybe a company or a supermarket and all that. Many people were taught how to use the thermometer, the thermoscan, to check temperature. So it's something that anybody can do. The things that you want to do, it's something that anybody can do. It's something that you're even doing subconsciously that you didn't even know you're doing. You're caring for your elderly parents, you're caring for your children, you're caring for your sick aunts, you're caring for your sick uncles. Like, indirectly you're doing that, but you don't even know you're doing it. So everybody have the capacity and the capability to care for people, and these are the things that you can even. So these are the things you can also put in your CV, just to boost your CV. One thing you need to know is you need to be able to package your CV well. You need to be able to package your CV well. Like, most of the things that are written, that are expected of the person that is needed for this job, should be part of the things you should include as your qualities, as the things that you can do, because those are the things they're looking for. Like, for example, now on apps jobs, if you go through track for a job, there's something called job specification or job specific. Those things, you have to read them. Those are the things that they need from this person applying for this job, and from there you can add it to your qualities, and for you to write your support statement and all that. It will really help. So let's go to the process now. How it works is the same process with the way nurses are being recruited. So I'll just say it the way it is. So once you have your passport, you have all this IELTS, you have the care certificate and the experience. Now let's go. So you are applying. I am not saying you should even wait to have all these things before you apply. Okay, while you're doing all these things, make sure you have applied and you're still applying, and then make sure that you get you keep applying and make sure that you're getting all those other things that I mentioned earlier. So when you get all these other things, it's fine, because the process will really take a while before the job will expire, before they will call you for interview and all that. Okay, let's say now, with prayers and hard work and everything that you've put into it, you've got a job interview. One thing you need to know is it is not everybody that are being called for it's not everybody that's being called for interview that will get a job offer, because like I said, this position is highly competitive. So what you want to do is you want to put in the work, you want to be able to gain the experience, not like you just put it in your CV, because from the interview they will know if you have the experience or not. Because there's some little terms, there's some little things medically that will just be coming out of your mouth if you're a medical personnel, or if you have a medical background, or you've actually worked in a healthcare settings. So all this will really help you if you actually put in this work to gain the experience. It doesn't take anything, actually, like I said. So you put in the work, you do a lot of work, you do a lot of applications, and then you're able to get an interview. And by the time you're going for the interview, you want to prepare so well for this interview. You want to pray for God's favor and all that, because it's very, very important. There's nothing you're doing. God factor is number one. So you want to pray for God's favor and everything. And then after the interview, let's say, okay, you've gotten the job. Congratulations, there's a job offer for you. So when you get a job offer now, I'm sure they will send you, the job offer will be like a letter, and to be sent to you, and it will request you, to request of you things that you need to send to them. But while you're preparing for all these things, I mean, while you're applying for the jobs, and while you're getting interview invites, you might actually want to do some things, because these are the things that will be expected of you um after the interview. Some will require some agencies will request that you get it. What did I say? This one is even a must, like a TB certificate, tuberculosis certificate, which is actually done either in Lagos or in Abuja. You just want to go to IOM. I think there's a link where you can apply, because you have to apply online for it. Is IOM, that's International Organization for Migration. That's where you apply for the tuberculosis certificate or tuberculosis test, and then you go for it. You'll see the option of either Abuja or Lagos, anywhere you want to go to. I think Abuja is more people. I think Abuja is better because of traffic. Lagos traffic is really high, but anywhere you want to go to, you can go. And this is like about 58,000 something. There's something on top, or let's just say 59,000 for this tuberculosis certificates, because there's nobody coming to the UK that was spending more than 6 months that would not get a tuberculosis certificate. So you need to get the tuberculosis certificates ready. You need to get proof of address. That's another thing I know they always ask. And at this point in time, people will start running kit, running kata, because they have not prepared themselves. You need to be sure that whatever address you're using now, you have some documents. I think they call it notarized documents that carries that same address. Because some people are actually moving from one house to another house to another. So what you want to do now is you need to be able to know that, oh, there's a particular address now on my maybe international passport. No, they won't even ask for international passport. I think maybe driver's license, maybe voter's card, NIN that we have in Nigeria, national identity number, and then the certificate itself. That certificate they give after you apply. What other kind? Bank statements. Yes, you can use bank statement. If the address, you can use utility bills. If the address on it is the same with the address you're putting as applying now, because to get to a state, you'll be able to help it out. Whatever address that you have put on that your application is what will come on your job offer. So your job offer, whatever address that offer is carrying, is what is the same, is that same document that you're providing has to carry that same exact address. So now you might start working on that, working on your proof of address, so that it doesn't make you run helter skelter when need be. So you get those things ready. TB certificates, proof of address. Sometimes they will ask for two, so you need to get those kind of things, or work towards making sure that the address that you have those documents on are the address you're using for everything you're doing. So by the time you get those things back to them, That's the employer back to them. Anything they said you should send, maybe your work certificate, your care certificate, all those things. You're sending them your IELTS and all that. You send it back to them. They will use these things to process your COS, which is certificate of sponsorship, because this is the basis for the visa application. There's actually a number on the certificate of sponsorship. Certificate of sponsorship will also come in like in an email, like more like a letter. You understand? That like an official document. It will be sent to you, and once the certificate of sponsorship gets to you, there's a number on it, and that number will be used during application for visa. Yeah, by the time you apply for your visa, they will ask for things like that. So, and when your COS is coming, that's the certificate of sponsorship, it has to come with maintenance. It's something that you really want to know. Maintenance means that it covers you and your family, it covers you and your wife, it covers you and your husband or your children. That's one of the benefits of this kind of visa. So the benefits, at least, it will be able to come in with your dependents. You'll be able to is a legal entry, like you're entering like a queen, or you're entering like like a king, like legally. That's what I mean, because they need you. The job is in the shortage occupation list, so they need you. That's why you're coming. So that one. So one other thing you also need is the police clearance certificates. Police clearance certificate, PCC, that one is very easy to get. You can get it in Lagos. Most especially, people get it in Alagbon, in Ikoyi, in Lagos. And it's not expensive at all. It's just between 5,000 to 10,000 naira, depending on your negotiation power. It's not expensive, and within a day or two, that one is ready. So you don't want to, because all these things have validity. Like police clearance now, I think is probably 6 months. Tuberculosis certificate is 6 months. So you don't want to rush into doing all these things. Just make sure that you're already at the level of, maybe the interview is already looking so clear to you, and probably your job offer, probably you've done interview and they've told you that you're successful. You're only waiting for the what's it called, the job offer, like in print, in a letter, so you can do you can start working on those things, because those are the things that they will need, even if they don't even ask for your tuberculosis certificate, because some people won't even ask. But at the level of the visa application, it's something that you will need. So by the time you've gotten a job offer, just go ahead and do the tuberculosis certificate and make sure that it's handy, so that by the time you're applying for visa, it will not be a delay for you. So by the time you get onto this level, you apply for the visa, at most in 3 weeks, this visa will be out. The visa will be out. And once the visa comes out, you pay for flight tickets. Some trusts will pay for all these things. Some agencies will pay for all these things. And then I don't think agencies should be actually demanding for money, because I know some agencies that are actually recruiting, I actually send some links, or let's say some job vacancies to some people of late, and those one are actively hiring at the moment. I'm just going to leave it in the description, in my description on this video, so you can easily click on those links and then apply directly. Even www.carehome.co.uk, if you click on it, you will see all these care homes that are recruiting, track jobs, Indeed, total jobs, all those ones, but majorly carehome.co.uk, and then all these other the exact care homes that are recruiting. I'll drop the ones that I know, drop the link, and then you can check them out. So normally, if you're going through an agency, you can actually apply directly. There's no problem. But I learned that some agencies are recruiting and they are demanding for money. I don't know what that is meant for. Some people have actually paid this money and have come in with it, but I don't think that should be right, because any agent that is recruiting for any employer means that the employer will definitely pay the agency. So they shouldn't be taking money again from the employee or for people applying. But I don't know. So you might want to just apply directly and just pray to God for miracle to happen and for everything to work out fine. So majorly, I think that is just it for it. So, but some, I think Hallmark is recruiting. So, like I said, Hallmark is recruiting. Actually, sent out some links and job vacancies to some people recently. Hallmark Care Homes, Avant Care Homes, they are recruiting actively now. Total Health, they are recruiting actively. Avant Care Home, they are recruiting. Zest Care Home, they are also recruiting. So I'm just going to drop the link to these agencies, and then you can just click on it and apply. And you just have to look out for frauds and everything, because around this time our people, because they know that people are really desperate and people really need to go through this thing. So some new agents will just be opening and be saying they can help, they can recruit, and also just look out for how you can use the psychology to discover fraud. But for me, I would advise that you guys should apply directly. There's no crime, there's no harm in doing that. Just apply direct. Don't be too desperate. Just put everything in God's hands. Okay? Just apply directly and do the needful. Get all these things. Package your CV, do everything. And by the time you're getting experience from the care home, either care home or wherever you're getting your care experience from, make sure that you let them know, maybe the doctor or the nurses in that healthcare settings, that you will need a reference from them. It's very, very important, because by the time you're filling your application, especially on track, they will ask for reference, and you don't want to give reference of probably you studied something different. You cannot be giving reference of your supervisor or your boss in that settings that you studied. Maybe you studied physics, or you studied or maths, or you just studied one course like that. You won't want, or you're working in a different setting, you won't want to give a reference of that person, because it doesn't gel. That's what I mean. So you want to let them know that you will use maybe the name of the organization and the name of the CMD, that's Chief Medical Director, or the medical director of that organization, of the hospital, of the care home, or of the, what's it called now, elderly home, anyone, wherever you're getting your experience from, or any senior nurse in that hospital, that you want to use the person as a referee. So the person can actually, when they get to that point, because they will contact your referee, they must do that referencing part. So they will send them a mail that you might not even have access to, and make sure that anybody you want to use, let them be someone that's really approachable, someone that can quickly answer mail quickly, because some people even get delays in this aspect of referencing. So someone that's really appreciable, someone that's internet inclined, somebody that can quickly check their mails and respond and all that. So the person will be able to respond to them, and then from there they can take it up from there. So I'm going to just do a short video of how this thing works, like how you can apply, because a lot of people have been asking questions, how do I apply, do I go about it? So I've talked about it step by step on how to get this thing. I've talked about having UKVI IELTS of 4.0 or 4.5 or 5, but basis of 4.0, you get. So after you have that one, you have the care experience. Like I said, you want to get a care experience just to know the basis of what is done in nursing. You want to have some medical terms in your brain. You want to put it in your CV. You want to boost your CV very well. You want to package your CV very well. You want to go to the job specification of I'm going to show you in the video that I'm going to do, where you can get the job specification, where you can see what's it called now, the qualities of, or the things that is expected of this applicant. I'll show you guys, and then you can use it to boost your CV and also to write your support statement. And by the time you're applying for this job, since you're applying directly, just make sure that you read it very well. You see some that will say they are not giving sponsorship. So there's no point wasting time to apply for these jobs. Some are giving sponsorship to people that are already in the UK alone. You know, some people are giving this sponsorship to people that are already in the UK. This tier 2 sponsorship that says like work kind of visa. They're giving it to people maybe like students that are working in the UK, maybe dependents of someone, you know, things like that. So they are giving the sponsorship to people that already do. You want to look out for that and hope you are not applying for the wrong type of job. Why some people are saying that people outside the UK, people that require that two sponsorship are eligible. So when you see that one, you can apply for it. That they are eligible. They will say overseas sponsorship. They are giving. Some will say they are giving the same equal rights to whether you are in the UK or you are outside the UK to apply. All these kind of jobs are jobs that you want to apply for. You don't just want to start wasting your time, you know, sit down there and keep applying for just anyhow jobs, because they might not get back to you, and there's no point doing that. So I'll show you guys, you can actually look for support worker in with sponsorship. You can look for healthcare assistant, senior carer, all those things with sponsorship. Make sure that there's sponsorship before you apply. Read about it, everything about the job before you apply. I'm going to show you guys shortly how you can navigate your way around, you know, searching for the right job and applying for the right job. That's at least very important. If you are starting wrongly, you know that already there's no headway. But if you are starting in the right direction, if you're doing it in the right direction, then you know that you're doing. That's why we're here, and that's why, you know, we're putting you guys to. That's why you guys need to give me a thumbs up for this particular video, because as in the time I've made this video, but I don't need to just quickly do it because a lot of questions have been coming up, a lot of, you know, things that people need to get clear. So do that. IELTS, care experience, care certificates, you know, and then apply. Then from application, you want to get your police clearance, you want to get your TB certificates, and then from there you get an interview, get a job offer, from there to COS, and from COS to visa, and from visa to your flights, and then here you are in the UK. So it's that's loaded. So that's it. After now, so I'm sure you guys now understand how to find your way and how to navigate your way through this job search, and how to be able to get the right job and apply for the right job. So look out for all the things, and then I wish you guys good luck. I wish you guys all the best in your job search, and I can't really wait to see you guys in the UK. I wish you guys all the best, really. Make sure that you put God first in everything you do. Make sure that you acknowledge Him in this phase, and then I'm sure it's going to work out. I'm just pretty sure. Just be optimistic. Don't just be, even when you are getting unfortunate mails, because we actually get so many unfortunate mails when you're applying, but don't be how will I say it now, don't be weary, and don't give up. Okay, just keep pushing, just keep applying, and it's just for a period of 12 months, so we really need to start now. Like, if you ask me, the time to start is now, like now. So just do all these things, and I'm sure that you're going to get there very soon. So guys, this will bring me back to the end of this video. Please guys, I'm begging you guys, like this video, share this video. A lot of people have been asking so many questions about this video, and I don't want them to, you know, start in the wrong direction. Share this video to as many people as you know, so that's why this video is really long. Like, it's really long for comfort, but then I have to just do it, and do it once and for all. Please make sure that you give me thumbs up, make sure that you like this video and share it, and don't forget to also subscribe. Don't just come here to watch. Please subscribe to this channel. Stay tuned so that you get all the good stuff, like all the information that you need to get as they come out on this channel. So guys, thank you very much for watching. See you guys in the next one. Bye.